I want to just outline the assistance that Eastern Caribbean Central Bank provided during the COVID era. In fact, we were first of the blocks to our governments, our member states, providing $4 million in grants. The reserve allocation was also changed from 60-40 to 75-25 to provide greater credit to the government so that they could use to provide the assistance and to put in all of the infrastructure that Minister Baldwin spoke about. Of course, it wasn't all that they needed, but it went a long way in ensuring that they could have started off. And also, together with the Caribbean Bankers Association and the Caribbean Congress of Credit Unions, we ensured that a program was put in place for moratoriums across our member states. A moratorium on interest, no late charges, and other fees. And that program initially was for 6 months, but it was extended to almost 2 years. The last of that program ended in March of this year, and it was introduced in 1st of April 2020, and the last one ended March 31st, 2022. So the Eastern Caribbean Central Bank, we were at the forefront in that fight, and we continue to be at the forefront. Minister Baldwin spoke about the fact that, CDB needed to do more in terms of ensuring greater financing at concessionary rates to our member states. And I'm pleased to inform the minister that last week at the IMF and the World Bank meetings, we again made that case until we got a response from the managing director of the IMF that they will now begin to reconsider that position. No promises were made, but at least there was a reconsideration of that position in terms of Antigua and some of the other countries being deemed to be high-income states and consequently not eligible for concessionary financing, but also, which was for us very important, to take a different approach in looking at member states and SIDs, to look more on an individual basis rather than, one of the accusations that have been made for the IMF is that they come with one solution and it fits for everyone. But Miss Cristalina Gioviniana, I think is the last name, I can't pronounce it properly, she did say that this is the approach of the IMF. And so, Minister, we continue to work on the behalf of our member states to ensure that, as we see our vision, is for the transformation of the Eastern Caribbean Currency Union, where we advance the good of our people, where they don't only strive, but they thrive. And that's a commitment that we make and we hold dearly. So, Minister, we have you. Okay. Good. Thank you. So now I move to my presentation. The macro-fiscal challenges in the Caribbean. Is there space for increased investment in health? In fact, I was heartened at some of the recommendations that we have, and one of the key recommendations is, in fact, the greater focus on primary health care. And Minister, you addressed that well. We will see some of I didn't share my presentation with him, neither did he share his with me, but you will see that there's some similar veins going on, and that just is actually very good. I'm actually expected to see a little bit more social security here. I'm only in a few social security phases. But it's wonderful to be here. So Minister Baldwin, Mr. Slaughter, and to all of you, good morning again. Slides. I have my, okay. So I will be let me go back, sorry. Okay. So this is going to be the structure of my presentation, the key messages, the macro-fiscal conditions in the Caribbean, the key health challenges that we face, policy recommendations, and my final remarks. So our key messages, we know that COVID, it didn't go. Why are we not moving? It moved, okay. All right, moved earlier. Okay, so you'll move for me, right? Perfect, wonderful. So what are our key messages? Our key messages are we are COVID-19 and now the Russia-Ukraine war negatively impacting our region. And so in light of all of this, we see the pressure on health and the pressure for the universal health care. It has stemmed on account of this. We're going to speak about that more. And again, policymakers should therefore prioritize investment in primary health care services, enhancing efficiency within healthcare systems, and managing the NCD crisis. Minister alluded to that when he spoke and informed us that next year the government will be putting this legislation not just on sugar, but on sugary drinks. They've already started with tobacco. And we know that NCDs is maybe one of our biggest challenges. I don't know about you, but to me, every day, I'm from Dominica, every day I see news of young people dying, 23, 25, 35. In the last few months, it's like nobody older than 40 has passed away. It's young persons. And when you hear what they've died of, cancer of all kinds, cancers you never even knew existed. Before you only heard about breast cancer, colon cancer, prostate cancer. Now there's cancer of the throat, cancer of the anus, cancer of the duodenum, cancer of the pancreas, all kinds of cancer. Not only that, strokes. A number of young persons, a number of our persons, but also now young persons dying of strokes. Diabetes is on the rise, high blood pressure is on the rise. And what are the implications for that? Earlier, it was this year, we had this conference on NCDs, or was it last year? And whereas before we often saw NCDs as only a health issue, these NCDs have serious economic and financial implications. NCDs is not just about health. NCDs is about our social and our mental well-being. It's about our financial wellness and security and resilience. And when we take it overall in our nation, it's about the financial and economic growth of our nations. NCDs is critical and has to be our focus going forward. And so, looking at the global economic growth, what do we see? We are not the only one impacted by inflation, by reduction in economic growth because of, again, COVID-19. It was a global pandemic. And so we saw a drastic decline in economic growth across the world, 2020. 2021 was climbing back up. But the forecast for 2022 was in the 6% region. That has now been downgraded to 3.2%, with a further decline globally of 2.7% for 2023. We saw inflation. Inflation is rising. Some countries as high as 20%. 9.5 is the average globally. And we feel it. I don't know about you, but I'm feeling it. And I say to myself, if I'm feeling this inflation, what about the more vulnerable people in our communities, in our countries? The price of fuel, triggered to a large extent by the Russia-Ukraine, just to go to the decision to reduce consumption and production. That is only going to drive up prices. And as it drives up prices and the fears of inflation increases, what are the central banks across the world going to do? They are all going to increase their interest rates. Why? Because they want to minimize demand. One of the countries that we pay close attention to is the United States. And what is one of the key reasons why we pay close attention, not just because it's maybe one of our greatest countries for trade. One of the key reasons is that our Eastern Caribbean Central dollar, our EC dollar is what? It's pegged to the US dollar, 2.7169. That peg has been in existence for 40 years and counting, because next year, almost 40 years, we'll be celebrating our 40th year. But even before that, because while we were still ECA, it was pegged, and so that was 1973. So that is, what, 50-somebody years, almost 50 years, that we are pegged, and we have been pegged successfully. There has never been a threat on that peg. And we continue to work to ensure that that peg of 60% never gets compromised. Because while we must keep it's pegged at 60%, we must have 60%. It means that for every dollar, EC dollar, we must have 60 US cents. We've always been in the region of 90 cents and above. We do not want to compromise that. And so we have to pay attention to also take the actions that we need to take. And so when we look at the economic growth in our region, again, we average in 2022, our average was actually better than the global average. Our average for 2022 is expected to be 10.5%. And that was because we saw in a lot of the countries, and Minister Malwin spoke to the fact that Antigua opened very early in 2020, we saw the rebound of the tourism sector. That was really one of the key factors because a number of our member states, tourism is critical. We speak of Antigua and Barbuda, we speak of Anguilla, we speak of St. Lucia, St. Kitts and Nevis. For these 4 countries in particular, tourism is key. They also, in terms of circulation of money, part of our biggest circulators of money, Antigua, St. Lucia, in that region. And so we saw that. But what have we done too? We also have downgraded our expectation for growth to 6.9% and 5.9% next year. Inflation is a big issue for us, and we continue to monitor that. In fact, our governments are taking lots of measures to contain inflation. But as they do so, what are they doing? So as they remove the subsidies, the taxes on fuel, they provide subsidies in other areas, taking resources away from other areas. One of the areas that has been affected is the health sector. It's also increasing the debt burden to the governments. And as Minister Malwin so clearly outlined, the fact that some of the countries are unable to access concessionary financing, just think of the cost and the burden, the financing burden for these countries. But again, I think the stance of the ECCB has been that we are going to look collective. If we cannot get it collectively, we were going to continue harping on that table. Slide 4. I kind of spoke about that, but as you can see from that little graph, and I talked about the debt, you see that there was a decline 2019, but from 2020, a sharp increase. My second slide will give you a number. So whereas the target for our member states is that the debt to GDP should be no more than 60%, and in 2019, our average was just a little above the 60%. But from 2020, with the COVID-19 pandemic, and right now with all of this Russia-Ukraine war, the supply chain challenges, and the other areas impacting inflation, impacting resilience, we see that moving are now 83.2%, a significant increase from the 65%, almost 20% increase in a space of about 2 to 3 years. And again, what does it mean? It means this debt has to be paid. And so at some point, we too will continue to feel that burden. And why it is so important for the concessionary financing. And I know ECCB also, we're speaking very closely with the CDB to ensure that we're able to provide that for nations. So what are some of the socioeconomic impact on the Caribbean, given all of the crises that we face? And we know that one, as we said, our already constrained fiscal spaces, even before COVID-19 and the Russia-Ukraine war, rising inflation, there were challenges by our governments. In some cases, economic growth was in the negative region, but that is now even more constrained as the governments must find money to provide relief, especially for the vulnerable people in our society. We cannot ignore them because, as is always said, a nation is characterized, and that is from Professor Fiedler, who was the head of HEU for many, many years. Professor Fiedler strongly held that a nation is known by how it treats its vulnerable, its young and its elderly. And so that means we also cannot compromise that. So again, we prioritize. And as we reprioritize, what happens? Health, which was really, and you will notice in our member states, our health percentage of our budget is really small compared to even the wider CARICOM and globally. That gets even more compromised as other areas take attention. Again, the higher inflation, higher food prices, the chance of persons falling into poverty increases. And while our governments have been working so assiduously to control poverty and reduce it and to provide that space for persons. And that's why as ECCB, part of our vision and our mission is to kind of advance the good, provide opportunities where people don't just strive, because striving itself creates issues, and leads to NCDs. Because if you are in a financially, think of yourself, when you are financially strapped, or if you ever get to be financially strapped, what do? You worry. What do? You stress, which leads to all of the other things. But not only that, you then also not make good health choices. Why? Because the healthier option is oftentimes much more expensive. And so what do? Do you choose between buying fish? If you have a family of 6, 1 pound of fish, where can it go? Can't stretch too far. You might get 2 or 3 fishes. A pound of chicken, you can cut it up and it can go and feed a whole family of 6 and more, because you make a pilau, you make something else to stretch it going. What do? Have you been to the supermarkets lately and see the price of vegetables? Have you been even to your local markets and see the price of locally produced goods? That too is increasing. So again, it's choices, and some of those choices can lead to the very issue we are trying to eradicate. And then, of course, our social safety nets we see are torn. I think it's Mr. Lalter who mentioned it, or even the minister. And some of our social securities are here in the room. During COVID-19, many of the social security institutions were called upon to provide assistance in the form of unemployment benefit. Because we know in the early stages, a lot of companies laid off persons. Some companies closed and have not returned. But these social securities, and I see Derek Osborne somewhere, the actuary who has served as actuary for many of these member state social securities, that was not factored in the design of the Social Security. It was not costed and paid for. And so it means the Social Security institutions had to use the reserves in order to provide that support. And as they do so, what do? If somehow investment returns, and we know investment returns fell because the interest rates across the world had fallen drastically in that period. It's now rising in the US, but that itself brings its own other issues. And so here too we see the compromise of that. Here too we saw governments again having to provide for the more vulnerable who slipped into greater poverty. And some persons who were just borderline actually fell there. And that cost has to be borne and stretches the fiscal burden. So moving on now to, the key challenges now in the health sector that we face. And on top of it is NCDs. You know that. Second is the cost of healthcare. It's not cheap at all. And the minister spoke about that. And he really stressed it a lot because they felt it. Having to put in the infectious center, having to find a structure, because no one, in fact, I took that down. Well, the first note I took from him was that in a crisis, what did you learn? You have to depend on you. Because when they thought the World Health Organization had all the answers mapped out and ready, they didn't. And as we do so, and the lady from Bahamas, I heard Lalta call her Charlene, she stressed that point. And maybe really, truly, we should not leave here tomorrow if we've not put together a plan of action to be implemented, not just spoken about, of how do we collaborate and coordinate our efforts to strengthen our health sector, to strengthen our safety nets within our region. And we spoke about the climate change. While yes, we are the least contributors, we pay the highest cost. But you know, very interestingly, green finance, more than $600 billion was given for financing climate change, and not $1 came to our region. That was one of the key messages Governor Antoine stressed at the World Bank IMF meetings last week. Not one. And so action has to be given so that some of that money comes to us. And we must come. We must come together to work together to ensure that green financing comes to our region. It cannot be each person fighting their own little battle, because we all feel it. So while the ECCB member state is 8 of us, and CARICOM is what, 20 or 22 members, we need to begin to work together. More, focused and intentional than we have been doing. Strengthening our public health systems, and we saw that, and where do you start? Primary health care. Because if we are able to nip it early, then there's no need for the secondary and for the tertiary. It will limit it. So the primary health care. Years ago, Dominica was carried under Dr. Carissa Etienne as, the primary health care model. I know we are working back towards that. We lost it somewhere, working back towards that. But again, when you spoke about the minister, you see too that Antigua is paying attention to that, and I think all member states, because we recognize, in order to address the problem, where do you go? You need to go to the root. Can't just be the symptoms we focus on. What are the causes of the symptoms? And if we address it from the root, then we're able to stem the problem. And of course, UHC. I mean, in some countries, we've spoken about that forever and a day, but nothing has happened. In Dominica, while I was the chairperson of the Dominica Social Security Board for a few years, and we had taken back on the mantle of universal health coverage. That was something started under the Prime Minister, Mary Eugenia Charles. And started, and then it fell away. And every successive government picked it up, and it fell away. And we were doing great work, and I resigned, and then they continued for a while. We had a secretariat, we had commission studies, and we fell away on the wayside. And 2 or 3 years ago, the government introduced to provide universal coverage for children below 2, I got children below 5, but have not, to the best of my knowledge, progressed beyond that. But we know that there is need. We see it all the time. And so I'm not going to spend too much time on that because we all spoke about it, but there was the Port of Spain Declaration of 2007. And the tagline for that was uniting to stop the epidemic of chronic NCDs. Where are we with that? If we have to do an evaluation, what is the pass mark we would be given? 100, 90, 80, 70, 60. Somehow it looks to me like it might be less than 50. And is that good enough? Okay, some categories we are high and some low, but overall, what's our overall average? Under 50. Is that good enough? Yeah, yes or no? No, it's not good enough. So I guess after this meeting we will have, they normally have communiques and declarations, and so we'll have a declaration that our countries need to do better and enhance that, so that when we have the 15th conference on UHC, we can report that we are now at 70 and counting. Then we see the cost of healthcare rising. See that little graph? From 2014 it was at a low, but look at where it is. Up and up and up. And if we don't take drastic steps, it's going to go higher and higher. But what happens when cost goes higher and higher? We may not be able to afford it. And what happens? While the cost grows higher, the quality of life falls. Unable to take care adequately, even to provide that primary health care that we speak about. And then what do we see? Increasing all sorts of diseases, not just NCDs, premature death, although some people say there's no premature death, but we see all of those things, and so it's something to manage. So how do we strengthen the public health care system? Again, what it showed us, and even with the COVID-19, those who survived well, who are able to we pretty well. And then, we kind of slacked off, and then, was it last year, August, we had increased, that was what? In one weekend, we had an increase of more than 600% of cases. But a robust healthcare system is important. Because health is really the new wealth, And we know that if you have everything else, but your health is compromised, what happens? It inhibits your ability to even enjoy all the other blessings that you have. And so it's critical we pay attention to health. Again, universal health coverage. Because that will help to contain the cost. But very importantly, it will provide access to health care, good health care, for those who are least able to provide it. We have to take care of our own. We have to take care of our vulnerable persons. Because if we don't, it can lead to even greater social problems. Think about it. And again, the lessons learned from COVID. It has to be a guide. And the minister spoke about that. All of these lessons we learned, are we going to just let it pass by? Or are we going to come together to ensure that we're able to do that? Our index for universal health care is at about 69. With our two areas of focus is the universal health, is NCDs and service capacity and access. So we have to strengthen that. And Ms. Charlene also spoke about this access and capacity. Because as we train, what happened? They're attracted to more attractive rates, more attractive benefits, more attractive opportunities. And we lose them to the US, to Canada, to UK, and so on. But what does that say, though? It calls and demands that we investigate, why are they all leaving? Well, we kind of know. But is knowing enough? What must we do to keep our talent that we have trained, but more importantly, that we need in our region? And not just in the healthcare. If you look at it, we lose talent everywhere. That brain drain is real. And this is a call for action too. And what must be done to keep our brains in our region? What are the opportunities? And maybe it means we have to revisit our terms of employment. And again, there's a cost. So the question is, if we are able to reduce cost on treatment and reduce cost on those, maybe we are able to then pay better to help in that prevention that we need and the focus on primary health care. And I'm about to end, I'm coming now to my recommendations. So one, to prioritize healthcare investment at the primary care level. I've said that throughout, and Minister also said that. Again, finding sources of grants, cheap financing, but of course to do greater collaboration. And yes, we gave one example about the procurement of pharmaceutical services, but there are much more areas that we can collaborate on. Second is to increase the augmentation of existing technologies to improve service access and delivery. And one of the first questions asked was about that in terms of technology. It's there, let us use it. And while earlier when Minister spoke about social media, and that social media can actually even exacerbate the issues and the politicization of issues, it can also be used productively. Because that's where the young people are. And you have to go to people where they are. In order for change, we have to meet people where they are. Not where we want them to be. We will get them there, but we must first find them where they are. And third, to alleviate the burdens of NCDs through fiscal disincentives. And Minister spoke about that, it's coming. So we have that, the sugar and other target taxes, incentivize the consumption of healthy products, for price caps, encourage local agricultural production, and the fitness. Encourage the movement. And you can do that as a little challenge. People like challenges, Caribbean people in particular. So maybe we can do a competition between communities, between businesses, between something to get us moving a bit more. Because truly, even if we eat well and we sleep well and so on, if we don't move enough, NCDs love that. Movement is critical in that. And one of the issues, from COVID-19, one of the side effects of COVID-19 is, sometimes you get diabetes and HP because of COVID-19. And that, if it is a COVID-induced diabetes or COVID-induced high blood pressure, and I'm speaking from my experience here, it responds really not as much to the traditional medication, but it responds well to movement, to exercise. It responds well to your herbal teas, well, from me. And in fact, I never had these things until I got COVID last year. And I battled to address that. So I got the high blood pressure under control, so that's no longer a factor for me. I'm still battling with this diabetes induced by COVID. But what I have found is that exercise, really watching what you eat, and not only that, the hours that you eat. I have found ginger, cinnamon, and I don't know what it is in English, but in Dominica we call it fay-twef. It's like a four-leaf clover. That has been very effective in controlling my diabetes. So I think it also speaks to us for a move to a more holistic and natural lifestyle, making movement a critical part of our lives. And so with that, I come to the end of my presentation. But what I really want to ask before I leave is to really urge us to use this forum, and when we leave tomorrow, to leave with an action plan that we have just not spoken about, but we are committed to implement. And that's why I'm going to hold HEU and the Ministry of Health of Antigua and Barbuda, since they are the key organizers, to put in place a plan of action, an implementation plan with deadlines and assigned responsibilities. And to put also a little monitoring and evaluation maybe every 3 months to see where we are. Because if you don't hold people to accountability, if you don't hold people to account, there'll be no performance. And who must we first hold to account? It has to be ourselves. Before we can want to hold others to account, we must take personal responsibility and accountability. And then you can then point fingers, because you can say, I am doing, what are you doing? But if we are not doing, how can you ask someone, what are you doing? When you are doing nothing. So this is my call to all of us. Personal accountability and responsibility to move this agenda, which will benefit all of us in our region. Thank you.